Good day everyone, I am 𝐬𝐨𝐜𝐚 from BSN111B, and today I'll be showing you my return demonstration in performing open gloving. So this procedure is significant for both patient and healthcare workers from infections. It reduces the risk of contaminating the healthcare workers from any blood or any bodily fluids. It also reduces the risk of germ dissemination to the environment and transmission from the healthcare workers towards their patient and vice versa. So the needed materials for these procedures are sterile gloves and a trash bin. The organization and completeness of all the necessary materials ensure our efficiency as student nurses. Now that you are already set, we can now proceed to the open gloving. So the first thing you need to do in open gloving is you need to perform thorough hand washing. This means that you need to follow all the steps in performing hand washing. This is essential as it decreases bacterial count in the hands and prevent contaminating our sterile equipment such as our gloves. Also remember that your nails must be properly trimmed so that we can avoid any difficulties in applying the gloves. Now I'm going to wash my hands. After hand washing, you need to prepare your sterile gloves, ensure its correct size, and inspect for any tear or stain on the package. So this will ensure the sterility of our gloves. So the size of my glove is size 7, and for checking that there are no tears or stains in the package. So next is we're going to open the package by removing the outer wrapper and carefully separating or peeling off each sides. Now we're going to grasp the inner package and place it on a clean, dry, flat surface because moisture can contaminate the gloves. And then we're going to discard this. Also ensure that your area must be at waist level because any objects below the waist is considered contaminated. Now we're going to open the package. So before opening it, you must need to follow the manufacturer's guide for opening it. So as you can see, there are folded tabs for holding or for opening the flaps. So what we're going to do is to pluck the flap so that our fingers do not touch the inner surface of the gloves. Now that you have already opened the package, we need to identify the left and right gloves. So this is the right glove and the left glove. So this is for my right hand and this is for my left hand. So each glove has a cuff approximately 5 centimeters wide. So for easy application, you need to glove first your dominant hand, and since I am a right-handed, so my dominant hand is my right hand. So we need to glove first my right hand. So with the half of my thumb and first 2 fingers of my non-dominant hand, grasp the edge of the glove's cuff for the dominant hand. And then, carefully pull over the glove over the dominant hand. Ensure that you are only touching the inside surface of the glove. And then leave the cuff and make sure that it does not roll up to your wrist. And also ensure that your thumbs and fingers are in proper spaces. Now that we're done gloving my dominant hand, we're going to do the non-dominant hand. So with my glove dominant hand, we need to insert our fingers inside the cuff of the second glove. Always remember that the thumb and your fingers of your dominant hand should not be touch any exposed area, and your thumb of your dominant hand must be abducted back. And now, we're going to carefully pull the glove over your non-dominant hand. Now that the gloves are on, we can now adjust each glove to fit smoothly. Always remember that you can only touch objects from sterile to sterile. Now that I'm done adjusting the gloves, we can now interlock both gloved hands at least 6 inches away from clothing, keeping hands above waist level and below shoulder level, like this. So this will prevent any accidental touching of non-sterile objects. Now, we're going to remove the used gloves and dispose it into its proper receptacle. To do that, you need to grasp the outside of one cuff with another gloved hand and pull the glove halfway down to the palm. Make sure you do not touch the wrist and turn it inside out. Next, grab your non-gloved hand or ungloved hand and then slide your fingers inside the cuff of the remaining glove and pull the glove away towards your palm and turn it inside out. And then discard it into the receptacle. Now that we're done, the last thing we're gonna do is to perform thorough hand washing to remove all the powder from the gloves that may contaminate or that may cause any infections towards our skin. And that's it for my return demonstration. Again, I am 𝐬𝐨𝐜𝐿𝐴𝐚 from BSN 111B, a student nurse from Davao Doctors College. Thank you for watching.